Strategies to Prevent Frailty, Falls, and Fall-Related Injuries. This course is presented by the British Columbia Ministry of Health and the BC Injury Research and Prevention Unit. While many people stay strong and active as they age, some are vulnerable to frailty. Frailty is a medical condition of reduced function and health, with less ability to bounce back from illness and injury. Living with frailty includes an increased risk of falling. The definition of a fall is to unintentionally come to rest on the ground, floor, or other lower level, either with or without an injury. Everyone will experience age-related changes that can increase the risk of falls and fall-related injuries. It's important to note that 1 in 3 older adults fall every year, and about 10 to 15% of these falls can result in serious injury. The circumstances in which an older adult slips or trips provide useful information for fall prevention. However, older adults often feel embarrassed or ashamed of having fallen and often do not discuss their fall with healthcare providers. Making small changes to prevent falls can save lives. The more risk factors a person has, the greater their chances of falling. Risk factors for falling are categorized as biological, relating to the health and abilities of someone's body; behavioral, related to actions, emotions, and choices; social and economic, related to the resources and support someone has; and environmental, or the degree to which where we live and spend time is safe and suited to our needs. Many strategies exist to reduce the risk factors for frailty, falls, and fall-related injuries. The Canadian Frailty Network works to improve care for older adults living with frailty and support their family and caregivers. The Avoid Frailty campaign recommends that older adults A. Stay active to maintain strength and balance. V. Vaccinate, as the body's ability to fight infection decreases with age. O. Optimize medication, as taking multiple medications can lead to dizziness and falls. I. Interact to create strong social relationships. And D. Prioritize diet and nutrition to keep muscles and bones strong. Biological risk factors for falls include chronic health conditions, such as diabetes and heart disease, and chronic health conditions that increase the risk of fall-related injury, such as osteoporosis. Understanding and managing chronic conditions not only reduces the risk of falling, but also increases well-being and quality of life. Physical activity, medication reviews, optometrist assessments, and good nutrition help reduce or manage the biological risk factors for falling. Improving strength and balance greatly lowers the risk of falling and injuries from falls, and has the potential to reduce or reverse frailty. The Canadian 24-Hour Movement Guidelines recommend physical activities that challenge balance and strength for all major muscle groups at least twice a week. Lower body strength helps older adults regain balance and muscle capacity to prevent a slip or trip from becoming a fall. If a fall happens, upper body strength enables an older adult to use their hands and arms to protect their head, neck, and spine from injury. Physical activity also improves overall function and boosts mood, energy, and memory. Increased strength and balance can help older adults continue activities they already enjoy, such as hiking, golfing, cycling and paddling, going for a walk outside with friends and family, playing with their grandchildren, and attending a community class or event. They may be happier and have more energy, think clearly, which allows them to be independent and remember things like names and appointments, and feel confident. Strength and Balance for Life, Stable, is an evidence-based set of resources to support well-being and independence by improving strength and balance and by reducing the risk of falling. Stable includes 3 levels of home activities: sitting, standing, and moving. Older adults can follow along with the Stable handouts or videos. Review the Stable resources for tips on exercising safely. Some medications increase the risk of falling, either alone or in combination. The effects of medication can change with age, so it is important that older adults have their doctor or pharmacist review their medications each year, including prescriptions, over-the-counter pills, vitamins, and herbal supplements. Call HealthLink at 811 for more information. In older adults, reduced vision or hearing is common and increases the risk of falls. To limit the chance of falls, eye exams are advised at least once per year. Older adults who use hearing aids should check that they fit and work properly. Speak to a doctor or make an appointment with the hospital audiology department. Nutrition and healthy eating can prevent muscle and bone loss and reduce the risk of frailty and falls. Canada's Food Guide and the British Columbia Healthy Eating for Seniors Handbook recommends enjoying a variety of foods. Older adults should eat regular meals and snacks, pay attention to hunger and fullness cues, eat meals with family and friends, and drink water. When picking foods to eat, these guides specifically advise eating fresh vegetables and fruit, including dark green vegetables such as kale, and orange vegetables such as carrots and sweet potato, whole grain foods such as oats, wild rice, and whole wheat pasta, and protein such as eggs, fish, beans, peas, and lentils, lean red meats, lower-fat dairy products such as milk and yogurt, tofu, and other soy products. Eating foods that reflect culture and traditions is an important part of healthy eating. The BC Elders Guide recommends choosing whole foods close to nature by eating from the land by accessing community gardens, fishing, hunting, trapping, or foraging. These practices incorporate traditional foods that are tasty and nutritious. Behavioral risk factors for falls include tobacco and alcohol use, reduced mobility, and a fear of falling. It is important to remember that older adults are at the center of their own health and care, and it is important to ensure that they retain control over their lifestyle. Information on behavioral changes to prevent falls can support a partnership between older adults, families, and care providers. Tobacco smoke narrows airways in the body, which can make it hard to breathe. Quitting smoking improves breathing, decreases the risk of infections, and supports engaging in physical activity. While vaping or e-cigarette use is not risk-free, it is a safer alternative to smoking tobacco products. Quit Now is a free program for people living in British Columbia looking to quit or reduce tobacco and e-cigarette use. The BC Smoking Cessation Program provides pharmacare coverage for 12 weeks of nicotine replacement therapy or prescription medication. Respecting Tobacco is a resource from the First Nations Health Authority, and discussing the differences between commercial tobacco and the sacred uses of traditional tobacco is important. It is important to manage alcohol use, as consuming any amount of alcohol is associated with increased risk of harm, including falls and injuries. There is a continuum of risk associated with weekly alcohol use. Zero drinks has no risk, and the benefits include better health and sleep. 2 standard drinks or less is low risk. This will help to avoid alcohol-related health consequences. 3 to 6 standard drinks has moderate risk. It increases the risk for harm, including injury, and the likelihood of developing cancer. 7 standard drinks or more is high risk. There is a significantly increased risk of harm, heart disease, and stroke, and each additional drink drastically increases risk. The health risks for females is greater than males when consuming above 6 standard drinks per week. Biological factors, such as enzymes, genes, lean body weight and size, organ function, and metabolism affect how alcohol is processed. Because of this, the impact of alcohol on females is greater, causing high blood alcohol levels, faster intoxication, greater risk of disease, and greater long-term harm such as liver damage and injury. Any alcohol use can lead to balance problems and increase the risk of falling, especially if used with medications, herbal remedies, or other drugs such as cannabis. Additionally, the rate of fractures also increase with increased alcohol use. Many people reduce or quit drinking in later life. Strategies to consider include counting how many ounces of alcohol are in each drink, keeping track of the number of drinks consumed, or planning alcohol-free days, thinking about why one drinks, planning activities that do not involve alcohol, and asking for support from family, friends, and healthcare providers. Mobility aids are devices including wheelchairs, as well as canes and walkers, adjusted to the appropriate height and used as directed. Additionally, footwear should fit properly, have a closed toe, have rubber treads on the soles, and have heel support in the back. If there is any pain or discomfort using mobility aids, consult a doctor, occupational therapist, or a physical therapist. Access Health Canada lists numerous assistive devices and advice on how to select and cover the costs of high-quality devices. For those at a high risk of falls, hip protectors can reduce the risk of breaking a hip by more than 65%. Wheelchairs promote independence and mobility. However, nearly 60% of people using manual wheelchairs experience falls. Reduce the risk of a fall when using a wheelchair by ensuring proper transfer techniques from the wheelchair. Install automatic wheel locks and use a wheelchair maintenance schedule to ensure it remains in working condition. Many older adults develop a fear of falling because they feel unsteady. Frailty, poor vision, and lack of support can also lead to a fear of falling. Fear of falling increases the risk of future falls because older adults will often restrict activity, lose lower body strength, reduce their mobility, and socially isolate themselves as a result of a fear of falling. Fear and risk of falling can be reduced by taking a fall risk assessment and participating in home-based activity to increase strength and balance, such as stable or Tai Chi. Social and economic factors are complex and can lead to social isolation and loneliness. Social isolation and loneliness affect many older adults and can be addressed by social skills training, joining community events and support groups, making friends with older adults, and through cognitive behavioral therapy. Creating age-friendly communities helps to reduce social isolation and loneliness by improving access to transportation and information. Most falls among older adults happen at home because of environmental factors, like tripping hazards and improper lighting, which can lead to falls. In order to reduce the risk of falls, install nightlights and glow-in-the-dark stickers on light switches. Remove throw rugs and clutter, and consider placing a commode beside the bed if needed. Additionally, good lighting reduces the transition between dark and bright rooms, and effective curtains can reduce the glare from the sun. Supports such as grab bars make the home safer and more accessible. The BC Housing Home Adaptations for Independence program provides rebates for low-income older adults.